I want to welcome all of you to our fourth annual Unsung Heroes of Public Health Awards ceremony. Since 2010, the Campaign for Public Health Foundation has enjoyed the honor of pulling back the curtain to thank and applaud public health champions. It's really fun. Every year we try to do it, and I'm always impressed by the awardees and their individual stories. You know, most Americans don't lose sleep thinking about the work and effort that's going on by public health officials and people in the trenches, and that's part of our effort here, is to make this more visible and to celebrate these individuals. Finally, AbbVie, our event sponsor, is a terrific company that has worked with us to highlight ways we can save lives, money, and suffering with renewed focus on prevention.
I'm old enough to have gone to medical school almost before antibiotics, but we had one elective, and my elective back then in 1961 was preventive medicine, and had opportunity to see and learn about what you folks are up against in trying to educate the public and policymakers, for that matter, about what is important about preventive medicine. Why do we have public health departments? What a waste of time. Why do they go in and inspect all those restaurants and close restaurants? They close my favorite restaurant. You hear that kind of stuff all the time. So it's a real pleasure to be asked here to come and applaud you all, not just the winners tonight, but all of you for your efforts in public health. You're really in the front lines of a war that never ends, defending the civil society through health measures. And Jim Krieger is a perfect example of it. And Jim, come on up here, and I suppose.
It's an honor to receive this award in recognition of the importance of the value of public health work at the local level. And really, it's not about me as much as about what my colleagues do across the nation, as well as in Seattle, to protect the health of the public. Because I also do clinical work. I work at the county hospital at Harborview and see patients there. And I see a patient who comes into my office, say, with asthma. And I can prescribe an asthma medication, and they go home to substandard housing, and there's mold, and there's cockroaches, and the medications don't work. So I can develop a public health program and work with partners where we go into people's homes and remediate the conditions or make sure the public housing is healthy. And then these kids go back to school and they can play basketball, and their asthma is essentially in control. Or what about all the folks who are exposed to or smoke or are smokers? Well, I can counsel them to quit smoking, but what if they then go back to a public housing unit or an apartment where the next door neighbor is smoking and the secondhand smoke is drifting in? Well, I'm proud to say just this year, we've converted all the public housing to smoke-free apartments in King County, and so nobody has to be exposed to secondhand smoke anymore. So those are kind of some of the examples of where I get really excited about public health and see how, if we're really going to make our community a healthy community, it's through these kind of activities that affect everybody, as well as what goes on in the doctor's office. So with that, I want to just thank everybody who I've worked with over the years to make all these things happen. It takes tons of partnerships with hospitals, with schools, with clinics, with child care providers, with public housing, and so on, to really make a community healthy. And so I'm privileged to be part of that community, bringing health to us. Thanks.
We have so many unsung heroes. We have unsung heroes in state health departments, county health departments, local health departments, and tons of them working in federal agencies that never get the recognition that they deserve. She holds a bachelor's degree in nursing from Catholic University and 2 master's degrees from the University of Washington in public health and nursing. She's clearly an overachiever and an unsung hero. So, Julie Wallace, congratulations.
Thank you to everyone who's here, and thanks for that applause. It is an absolute privilege and a pleasure to be singled out and to receive an award in a category called Unsung Heroes in Public Health. The foundation, the Campaign for Public Health Foundation's sole objective is, raising attention to the important priority of public health domestically, but in my case also from a global perspective, and that's something that's so important that I think we can all get behind. I also was proud to spend the day down on the Hill meeting with members of Congress with my fellow awardees. two very distinguished, really intelligent, bright individuals that just awe me in the meetings we had all day. Folks who were at the scene of the crime, so to speak, they're actually in the room today, and they're actually the ones who should be receiving this award. They're Hope Sukin, they're Richard Green, the U.S. Global Malaria Coordinator, Admiral Ziemer. Let's give them a hand. I also should say that Congress has done the right thing. Congress, this initiative started in the Bush administration, and there's few things that have been sustained from the Bush administration over to the Democratic Obama administration, and have continued. And malaria still entertains, and we hope it remains true for the budget appropriations that are under development right now and going forward. But it still maintains really bipartisan support, and it is because we've been able to deliver on what we said we were going to do. It's not have to accept this award on behalf of the collective team here and in the field. So I just want to say that, malaria, the PMI team, President's Malaria Initiative team, myself and all of us, along with our national malaria control counterparts, are going to continue to make waves. So thank you very much.
I'm here to introduce Ann Saker, who is going to get your Excellence in Media Award. She is a journalist for WCPO Digital in Cincinnati. She has worked for Gannett News Organization and UPI here in town. She's worked for the News and Observer in Raleigh and the Oregonian in Portland. She did a series of articles for the website of WCPO Digital in Cincinnati on syphilis, which in Cincinnati was at epidemic proportions. The people who benefit from that kind of work and the people who benefit from what Ann has done, not journalists, it's the public. It's the public whom you are concerned about. So having said that, let me introduce you to Ann.
Thank you very much, Bob. I want to say, first of all, thank you to the Campaign for Public Health Foundation for the award, and for Mike Samet of the Hamilton County Public Health Department for nominating the series. I had no idea until Carl called me last month that it had been nominated, and that came as a delightful surprise. I also want to thank Holly Edgell, who is a wonderful editor at WCPO Digital, who took Mike's call several months ago about the epidemic of syphilis in Cincinnati and then assigned it to me. I think part of the appeal of the story is just being able to say syphilis in Cincinnati. Because it's musical. But when I started finally drilling down into the story and I discovered how important and vital it was, how dangerous it was, how close we were in this country to actually eliminating syphilis at the turn of the millennium, and then doctors just forgot to test for it. And we started seeing a gigantic increase of it. And it's at pretty scary levels right now in Hamilton County. But the good thing about the story, and the good thing about a lot of public health stories, is that you can show that progress is being made. And as a writer, that's a really great thing, to be able to show readers that it's not all bad, that change is occurring. Your neighbors are doing that change, and we can do it together. Humbled and honored to stand with the true heroes today, Jim and Julie, and all of you who serve the public by worrying about the public health. I think public health is a measure of progress for the human species. Each step forward, despite the difficulties and the hassles, becomes a profound chapter in our human story. As a writer and as a witness, I stand today here in awe of you. Thank you very much.
This is almost the end of our program. I also want to thank AbbVie. Please join me seriously in giving them another round of applause. pass a hello from Congressman Jim McGovern, who came earlier today, and he stayed in the back. I offered him to stay for the closing, and he had a Rules Committee meeting to run to, but he sends his best. Also, Lucille Roybal-Allard staff is here today as well. I think I've seen, Bill Cassidy's staff is here, or was here earlier. Those three offices make up the Congressional Study Group on Public Health. It's a caucus. If you're here with a member's office and your boss is not on that caucus, please join. And also thank you to Dr. Phil Rowe of Tennessee, who's also an honorary co-chair or co-sponsor of this event. Thank you all to all of you. Thank you to our award winners, and let's do it again next year. Thank you.